Good afternoon, everyone. My name is Ariella Ortiz, and I will be guiding you through this health literacy workshop today. Thank you all for coming. We have two key areas of focus today. The first is addressing language and cultural differences, and the second is encouraging patients to ask questions. So let's talk about why addressing language and cultural differences is so important. The 2013 census shows that over 60 million Americans speak a language other than English at home. The 2013 census also found that over 311,000 individuals were foreign-born. Lastly, each culture has different approaches to healthcare. Individuals from poorer countries may not have ever had access to health screenings or preventative care, just as one example. Why is it important to encourage patients to ask questions? Well, Lisa Bernstein says that asking questions is one of the most difficult tasks that patients face. And this is because asking a question requires three things. First, a grasp of medical vocabulary. Second, a basic understanding of biology. And third, confidence to speak. We all can remember sitting in classes with a teacher lecturing for 35 minutes at a breakneck pace and then uttering at the end, "Any questions?" right as the bell rang. More likely than not, no one actually took that opportunity to ask any questions because we hadn't even had the chance to think of one. So this is helpful to remember as we are interacting with patients. Let's talk about what health literacy is. It has a two-part definition. The first is that it is the responsibility of the healthcare workers to provide patients with the necessary information to make healthcare decisions, and also equipping them to make decisions. And the second part is it is a joint relationship between patients and healthcare workers, communicating clearly and effectively. You can't have health literacy without clear communications on either part of the patient or the healthcare worker. Let's talk about some key communication principles. First, with addressing language and cultural differences. So here is a brief overview of some national policies. The CLAS standards are national health standards for culturally and linguistically appropriate services in healthcare. The standards are broken up into four main categories. The first is the principal standard. Then we have governance, leadership, and workforce standards. Communication and language assistance standards. And then engagement, continuous improvement, and accountability. We are going to focus on the principal standard and communication and language assistance today. So let's talk about the principal standard. The overarching principle behind all of the standards is to, quote, provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. The following standards give some concrete examples of how we can do that in our healthcare settings. So let's focus in on communication and linguistic assistance. First, we want to give language assistance to those in need. Second, we want to inform individuals about available language assistance services. Third, we want to check that the competence of those who provide language assistance is adequate. And lastly, we want to use easy-to-understand materials. The items marked with an asterisk indicate that this standard should be the same whether we're talking about oral communication or written communication. Now let's talk about some main ideas behind encouraging patients to ask questions. A very common program that has been used is the Ask Me 3 method. If patients ask questions, it helps to alleviate misunderstandings between patients and healthcare providers. This was created by the National Patient Safety Foundation and encourages patients to ask these three questions. What is my main problem? What do I need to do? And why is it important for me to do this? If a patient can't answer these questions, then these are good questions for them to ask their doctor or their nurse. So what can we do in our offices, in our hospital, to address language and cultural differences? Here are some good practices to keep in mind. We're going to talk about the 3 C's today. The first C is to create a welcoming atmosphere. The second is to communicate clearly. The third is to check understanding. So how can we create a welcoming atmosphere? Does anyone have any ideas? Great. Those are all awesome ideas. I came up with a couple other ones. So first is you want patients to feel welcomed in your office. By providing forms in languages your office commonly sees, you make it easier for patients to fill out forms on their own. If you display these forms instead of requiring patients to ask for them, it increases the odds that patients will not feel ashamed in order to need them and will actually utilize them. Second, you want to ask patients how to pronounce their names. Asking them how to pronounce their names is a great way to show that you care about them as a person. If you're unsure of the pronunciation, ask. You can even add a note to their file with phonetic markings to help you remember how to pronounce it in the future. And third, regardless of whether or not you think a patient needs interpreter services, ask if they would like them. This lets them know that the service is available and reduces the shame of needing one. Also, as a side note, do not use family or friends as interpreters. They are not trained and may not communicate the message clearly. Which brings us to our second point. Communicate clearly. The first thing you want to do is ask who the decision maker is. In some cultures, another family member or another member of the community may make the decisions. Ask at the beginning so that you can include this person in the discussion of treatment and diagnosis. Second, speak slowly and clearly. Enunciate. In a rush to give as much information as possible, it is likely you will speak quickly. For someone with limited English, this is a huge problem. Speak slowly, speak clearly, and try as much as possible to put a break between each word. Native speakers string words and sounds together, but to someone who is not fluent in English, those things can cause misunderstanding. Now you may have noticed as I talked about this point, I spoke slower, I spoke more clearly, and I made sure to put a break in between each word. If you can do this, it will really help out your patients who do not speak English as their first language. The final point is to use living room language as much as possible. As much as you can, you want to use simple language. For example, instead of using the word cardiologist, you can say heart doctor. Or instead of saying you have elevated BP, you can say you have high blood pressure. Also with this, be aware that it might take a translator or an interpreter extra words in the patient's language to communicate the idea. So speak slowly for the translator's sake as well. Finally, you want to check understanding. After you've given information to the patient, you want to make sure they understand. So here are some ways to do that. First, ask for questions. Encourage your patient to ask questions. We'll talk about this more in the next section, but make it clear that you want them to ask questions. Try asking, what questions do you have? Or, what question would you like to ask me? Second, avoid depending solely on verbal instructions. Can you use pictures, hands-on practice, or models in your office? Third, much of our communication happens non-verbally. Look for cues such as how loudly they speak, or do they speak at all? Are they making eye contact? Do they look confused or uncomfortable? However, be aware that different cultures have different standard body languages. For example, a head nod, like what we would do for yes, actually means no, so this is something to be aware of. Finally, confirm that your patient understands. You can do this with the teach-back method. Ask them an open-ended question like, how would you explain this to a friend? How will you give your daughter her medicine? If it appears that they're not understanding, then try a different form of communication. How can we encourage patients to ask questions? Do you have any ideas or any things that have worked in your office or in your department? Great. I have some other strategies as well, so let's talk about those. The first strategy is to ask for questions. Use language such as, please ask me, what questions do you have? This can be a really simple way to show the patient that you care and want their questions. Secondly, reassure your patients that it's okay to ask questions. Remind them that there is no such thing as a stupid question in regards to their healthcare. Third, you can ask questions. This creates more of a dialogue-based environment as opposed to a lecture-listen environment. You can also encourage more questions by preparing frequently asked question sheets. You could say, a lot of people have this question when they hear they have this condition. Would you like me to answer this as well? This helps out the patients who maybe are too shy or too nervous to ask their own question. Finally, you want to provide tools in your office that help with question asking. So, for example, by providing pens, paper, and clipboards in the exam room, you encourage patients to write down their information and questions that they may have. This is good for both questions and information discussed during the visit. In addition, if you post the Ask Me 3 in the exam room, this can help patients jumpstart their own questions. Remember, the Ask Me 3 questions are, what is my main problem? What do I need to do? Why is it important for me to do this? All right, what questions are there so far? We're going to take a short break, and then we'll do a role play exercise so that you all can practice what we've just learned.